Hello everybody. So in this video we are going to cover one of the few things I did not have model access to for my other videos for your digestive system, and that was your teeth. So you guys need to know some things about your teeth. So here we are. This is going to be your video about teeth. So your teeth have different shapes based upon the different jobs that they do. Your front teeth, the ones that you see when you're smiling and the ones when you are biting into things, are the ones that, like, break pieces of your salad off, or, you bite into an apple and you bite the chunk of apple off. These front teeth are called your incisors, right? You have 2 pairs of incisors on your front and bottom jaws. And then you have the pointy teeth. Those are the vampire-like teeth that you like to see, and they are the pointy ones. Those are called your canines. You only have 1 canine on both your top and your bottom. Right? The next 2 teeth down sort of have a slanted angle to them. They are pointy on the side that is closest to your cheek, but then they flatten out toward the back. So that you can chew things and bite and tear pieces of food off of things a little bit better. Those 2 pairs of teeth on your front and bottom are called premolars, or bicuspids. So premolars, and then the last 3 teeth you have on your top and bottom jaws on both sides are called molars. They are large teeth with flat tops and are usually used for grinding and chewing the food that you have just eaten and put in your mouth. You have molars come in at different ages, right? You have your 10-year molars, which are the ones that come in when you are about 10 years old. You have a pair of molars that come in when you are in your preteen years, and then you have what we call your wisdom teeth, which are the last pair of molars that you get in, that typically come in when you are like 18 to 24. They may start to come in crooked in today's society, because if you remember, a few hundred years back, before the invention of fillings and cavities and root canals and like anything else, if like 200 years ago, when toothbrushes didn't exist and you couldn't do that with your teeth, if those first molars that came in when you were a small child had rotted out by then, you needed the ones that were going to come in when you were 20 years old, so you would have more chewing molars later in life, right? So those molars were originally meant to potentially take the place of molars that had rotted out earlier in life, but now we brush our teeth and we floss and we use mouthwash and we take care of things. So most of the time, our jaws do not have space for all 3 of these molars, and generally speaking, it's a typical surgery for 18 college-age kids to have their wisdom teeth or those last set of molars removed, because there's just not enough space in the jaw for all of them. But those are your different types of teeth and their jobs. Couple things you should know about teeth, though, because you guys need to know a little bit about tooth anatomy, right? So the gum, your fancy word for gum is gingiva. The part of the tooth that you see above your gum or above the gingiva is called the crown. The part of the tooth that is under the gingiva that anchors your tooth into your jaw is called the root. And then the part of the tooth that is right at the base of where the gingiva runs along the side of it, right? The part that's like building up the plaque if you don't brush your teeth well and that kind of thing, that part of your tooth is called the neck. So crown is above the gums, root is what's anchoring your tooth down into your jaw, and the neck is the base where it's meeting the gum line. Right? So some things you need to know about your teeth and the internal structure of them. The outside of your tooth is protected by a covering called enamel. It's a protein covering, but once it's gone, it's gone. Your body cannot re-heal that, which is what dentists are always going on about, because you want to keep that protective covering for as long as you can. Dentin is this slightly soft calcium-based material that is underneath the enamel. It's what you would call the tooth part of the tooth. That's the part of the tooth that if you have a cavity, the sugary bacteria and whatnot have eaten away at your dentin, and the cavity is... We fill the cavity so that it won't be the dentin will not be broken down any further. Underneath the dentin, though, is the internal part of the tooth with the blood vessels and the nerves and everything else that would hurt. That area is called the pulp cavity of your tooth. So you have a pulp cavity in the middle top up here and a pulp cavity going down, right? Going down the air, and you need to remember that you don't only have 2 roots per tooth or 1 per tooth. These molars can have 4 roots in them, right? But the pulp cavity that's going down into the root area is called the root canal, right? So when an individual has had tooth problems that are really, really bad, and it's gotten to the point where this pulp cavity is infected or has substantial damage, a root canal is also a procedure that a dentist can perform, where they drill out the bad stuff in the tooth, and they will drill down where that root was and clear out that pulp cavity, and then they can either fill in that area if it's only the 1 root, or they can anchor the rest of the tooth down and find a different way to fix your dental problems. But it is painful because, remember, this is where the blood supply and the roots are in this pulp cavity. So there you have it. This is your tooth anatomy. The dentin is the calcium-rich bone-type white part of the tooth. The enamel covering is the protective covering on the outside of your tooth. The pulp cavity is the internal area where your roots, or where the blood supply and nerves are. The root canal is the canal where the pulp cavity goes down the roots of your tooth. Crown is the top part above the gums. Root is the part underneath. The neck of the tooth is where it's meeting or touching the gum line. And then your 4 different types of teeth that we have. Molars are the large flat ones in the back for grinding and chewing your food. Canines are the pointy ones. Incisors are the ones for biting things off that are your front teeth that we see when we smile. And then you have premolars between your canines and molars that sort of do half the job of a canine and half the job of a molar, which is why they are premolars. Right? I hope this video answered some questions that you had about this. If you have any questions, let me know. Thank you guys so much.